Stroke screening is a tool used by medical professionals who work with patients to look for risk factors and other variables that patients may or may not know about to prevent a stroke before it happens. A stroke screening can be performed in patients who have a family history of cardiovascular disease, patients with diabetes, hypertension, hyperlipidemia, former tobacco use, and any other condition that puts them at potentially increased risk of having a stroke. In order to prepare for a stroke screening, it's a good idea to gather all your medical information and your past medical history documentation and speak to your family members about any cardiovascular disease within your family. The workup usually will entail blood work, an EKG, an ultrasound of the heart, and further testing and evaluations, including ultrasounds of other key areas in the periphery, such as the neck or the lower extremities, to look for plaque buildup or atherosclerosis in those areas. The risks of having a stroke include high blood pressure, high cholesterol, diabetes, a history of tobacco use, a personal history of stroke or TIA, a mini stroke, as well as atrial fibrillation, which is an abnormal heart rhythm that can increase your chance of having a stroke fourfold compared to the general population. If you or someone you know is interested in a stroke screening, please call our office so that we can help you book an appointment and accommodate you accordingly.
There's a lot of reasons to be optimistic if you have high cholesterol. There's so many types of medications to treat high cholesterol that we can definitely find that's tailored to you. Many of the medications are well tolerated, they're affordable, and they're highly effective. The most common class of medications for high cholesterol are statins. Statins reduce the liver's production of cholesterol and also remove the LDL out of the bloodstream. As the name suggests, bile acid sequestrants remove bile acid out of the blood, and your body needs bile acids. And in order to make more bile acids, you need to break down LDL. So it lowers your LDL cholesterol. Niacin is a prescription grade B vitamin. It slows down the production of cholesterol from the liver. It also blocks the release of fat from fatty tissue. It's excellent in terms of lowering your triglycerides and increasing your HDL. Fibrates are a medication that we use that promote lipolysis, which is a fancy term for breaking down your triglycerides. So they're an excellent medication for lowering triglycerides. Ezetimibe inhibits cholesterol absorption in the intestines. So it basically clears the body of cholesterol without having to break it down and absorb it in the body. PCSK9 inhibitors are injectable medications that promote the receptors that break down LDL. So it clears LDL from the bloodstream. It's super helpful in patients with familial hypercholesterolemia, which is a genetic form of high cholesterol. siRNA therapy is small interfering RNA therapy. It's another injectable treatment. It works by lowering your LDL and removing it out of the bloodstream. It's used in many genetic forms of high cholesterol. It may take some trial and error to find the right medication for you. The good news is that if you have a side effect to one of these medications, there's so many other medications we could treat you with that are effective and well tolerated. So don't worry, your doctor and you will decide what's right for you. What you eat has a big influence on your cardiovascular health. Saturated fat is a major contributor to LDL. So LDL cholesterol is bad cholesterol. I remember it as L for lousy. If your LDL starts to increase, you put yourself at risk for plaque buildup in the arteries, which increases your risk of heart attack and stroke. Foods that are high in saturated fat are red meat, dairy, and fried foods. Trans fats are basically liquid oils that are converted into solid fats. They gain popularity because of their desired texture. They're very harmful. They increase your LDL, which is your bad cholesterol, and lower your HDL, your good cholesterol. Foods that are high in trans fat are margarine, peanut butter, fried foods, baked goods that you buy in a grocery store, and vegetable shortening. For a heart-healthy diet, you should try to avoid foods that are filled with lots of sugars, added salts. You should try to avoid alcohol, as well as ultra-processed foods. In a heart-healthy diet, you should focus your diet on fruits, vegetables, whole grain products, lean protein, seafood, nuts, seeds, vegetable oils such as canola and vegetable oil, and minimally processed foods. A registered dietitian can help your dietary changes when you're on a high cholesterol regimen, as well as many dietitians have a lot of experience with heart-healthy diet and can improve your habits when you're fighting off high cholesterol.
My name is Dr. Mary Elizabeth Greene. I'm a board-certified cardiologist with additional board certifications in echocardiography, nuclear cardiology, vascular interpretation, and internal medicine. As the Director of Women's Heart Health here at Manhattan Cardiology, I'd like to talk to you today about women's cardiovascular disease. Did you know that the #1 leading cause of death for women both in the United States and worldwide is heart disease? Did you also know that a woman is 10 times more likely to die of a heart attack than she is of breast cancer? By the age of menopause, a woman is equally likely as a man to die of a heart attack. The average age of menopause in the United States for women is 51 years old. If we are to live long, healthy lives well into our 90s, it is important that we pay attention early. My personal philosophy is that prevention is the best medicine. By being vigilant about our cardiovascular health and taking the necessary steps to improve it, no matter what your initial starting point is, will ultimately lead to a longer and healthier quality of life. While menopause is a pivotal time in a woman's life, as is pregnancy, oftentimes pregnancy can uncover undiagnosed cardiovascular disease. If you have experienced gestational diabetes, preeclampsia, high blood pressure during pregnancy, or HELLP syndrome, you may be at increased risk for chronic cardiovascular disease or stroke in the future. If you have experienced any of these conditions, it is a wise choice to make regular follow-ups with your cardiologist. If you are a young, healthy female actively trying to prevent pregnancy and think this message is not for you, think again. Most young women do not know that progesterone-containing hormonal birth control can lead to increased blood pressure and increased cholesterol levels. Increased blood pressure and increased cholesterol are both well-known and well-studied risk factors for cardiovascular disease. If you have experienced the side effects of increased blood pressure and cholesterol levels while taking hormonal birth control, you may be at risk for future cardiovascular disease. We all know that women's heart health is both undertreated and underdiagnosed, and I'm actively working to change that. So ladies, be safe, be healthy, schedule a visit with your cardiologist. I'm accepting new patients.
An exercise stress test is a test performed by your healthcare provider where you exert yourself on a treadmill that gets progressively harder over time. Your healthcare provider will monitor your blood pressure, your ECG signals, and also monitor you for symptoms to see if you develop any concerning issues throughout the test. An exercise stress test may be considered in patients depending on their personal history, their current presentation, their family history, any symptoms they may have. All these things are taken into account and discussed with the medical professional to decide whether or not you need a stress test. The main reasons to do an exercise stress test are to rule out significant coronary artery disease, symptoms associated with exertion, and also to assess a safe level of exercise for patients. Prior to a stress test, we advise our patients to stay hydrated and to bring gym clothes, change of a shirt because you might be sweating, and sneakers because you will be exerting yourself on the treadmill. In order to prepare for a stress test, we advise our patients to stay hydrated. Your doctor may also advise you to stop certain medications prior to the stress test as well. So the time it takes for a stress test really depends on each particular person and their age and gender. The results of a stress test are either normal, meaning there are no significant blockages or arrhythmias noted with exertion, abnormal, which means that there may be a significant blockage or a significant arrhythmia associated with exertion, or they can be equivocal. At the end of the stress test, we go over the results with the patient on the spot. We have certain criteria that we use during the stress test to determine someone's exercise capacity, and that's one of the beauties of doing a stress test as well.
High cholesterol generally does not cause symptoms. Some people are walking around and they don't even know they have high cholesterol until they have a medical event like a heart attack. The key to prevention is early detection. LDL cholesterol is bad cholesterol. I remember it as L for lousy. So if you have high LDL, you're at higher risk of plaque buildup in the arteries and could succumb to heart attack or stroke. So in the average risk person, you want to keep your LDL somewhere below 100. If you have a risk for heart attack or stroke, you want to keep your LDL below 70. HDL is known as good cholesterol. I tell my patients H for happy or healthy. The higher the better on the HDL. In men, you want to go for a range of about 40 or above. In women, you want to strive for 50 or above with your HDL. Triglycerides are a type of fat that circulate in the bloodstream. High triglycerides lead to heart attack and stroke, so you want to keep your triglyceride levels below 150. Cholesterol tests are essential. It's a blood test that measures different types of cholesterol in the blood. Adolescents should get their first cholesterol test between the ages of 9 to 11 and then repeat every 5 years. For young adults above the age of 21, you want to get screened every 5 years. For middle-aged adults, every 1 to 2 years. If you're above the age of 65, you want to get screened every year. However, if you have risk factors for heart disease and you have a certain level of high cholesterol that's abnormal, you might want to get tested more often. LDL cholesterol is bad cholesterol. I remember it as L for lousy. So lifestyle choices may cause your LDL to ramp up unnecessarily. Once it increases, it could increase your risk of plaque buildup in the arteries and lead to heart attack, stroke, and issues with poor circulation. Lifestyle factors that are linked to high cholesterol are smoking, poor diet, lack of physical activity, and being obese. Saturated fat is a major contributor to LDL. If your LDL starts to increase, you put yourself at risk for plaque buildup in the arteries, which increases your risk of heart attack and stroke. Foods that are high in saturated fat are red meat, dairy, and fried foods. In some cases, people don't even know they have high cholesterol despite a heart-healthy diet. They may have something called familial hypercholesterolemia. It's a genetic disorder where you may inherit a gene from one parent or one grandparent which causes them to have high cholesterol. This early high cholesterol pattern can put you at risk for early heart disease or early stroke. So it's really imperative to check and make sure you don't have high cholesterol at an early age. Some other conditions that may increase your risk of high cholesterol is type 2 diabetes or being overweight or obese, both of which increase your LDL, increase your triglycerides, which are bad for you, and decrease your HDL, your good cholesterol. You can work with your healthcare team to manage your risk of high cholesterol by suggesting lifestyle changes, referring you to a registered dietitian, prescribing medications such as statins to improve your cholesterol levels, or improving other conditions such as diabetes, specifically type 2, as well as controlling your blood pressure to reduce your risk of high cholesterol.